Let's discuss the reproductive health law some more. Joining us this morning is UP Center for Women's Studies Director, Dr. Sylvia Estrada-Claudio. Good morning, Dr. Claudio.
Good morning.
Thank you for joining us here in Daybreak. Now, just to recap, let's look into what were the objectives of the RH law, the main objectives.
Well, one of the main objectives, of course, was to ensure the health of women, especially during the time of pregnancy and after that. So, not just that they shouldn't die because of pregnancy and childbirth, which is happening still in the country at levels unacceptable, given what we have in terms of our medical capacity to prevent that. And also, not just death, of course, because there are other forms of complications and morbidities, and we also wanted that to be lessened. So that was one of the main goals. But it is really about the health of women in general. So there are provisions about violence against women, which is another cause of great morbidity and death for women. There are provisions on cancers. There is a provision on infertility, because this is also a health and reproduction issue. There are provisions, of course, in terms of men being more involved with the care of their children. So to a large extent, it is not just about women's health. It is also very much about the health of children that is tied up, of course, to the well-being of the mother.
Okay, now, the hotly contested provisions of the RH law has been sex education and the distribution of contraceptives. Now, the Catholic Church and those who are against the RH law have said that it violates the constitutional principles on abortion, religious freedom, and marriage. Now, if, for example, we remove that provision on sex education and the distribution of contraceptives, would we still be able to answer those objectives that we have specified?
Let's take it by one. Most of the leading scientific and medical organizations, both here in the country, like the Philippine Obstetrics and Gynecological Society, which has put its weight in support of this law, and for the International Organization of Obstetricians and Gynecologists, as well as the World Health Organization, have agreed that there are three important pillars necessary to reducing maternal mortality. And what those three? And these are pillars. So in that sense, you can't just have two, you need all three.
Okay.
That would be one, access to a skilled birth attendant. Second, of course, access to an emergency obstetric care facility. And access means that if you have any trouble, you can get there easily enough. Okay? And three, provision of contraceptives. The law requires all three. And so in terms of the argument, and I've heard it from the anti-RH law forces, that we can just have the two, skilled health birth attendants and a good facility, that isn't being held up by the scientific evidence. Most of the studies, the best run studies, are showing we need all three in order to effectively reduce
So the provision
deaths.
on the distribution of contraceptives is part
important.
of the pillars
It's
that
part
they
of
have
the pillars
identified.
that identified.
Now, what
in
about
order
sex
to do that.
education? I mean, some are saying that, it should be between the parents, and, as parents, you also have three sons.
Yes.
It's something that you really can't avoid. Even without the sex education in school, you really do talk about it at home.
Yes, you do talk about it at home, and I have met many other parents who have said to me, some of them, my friends or my relatives, you do it. I can't do it, you do it. And so in my family, some of my sisters-in-law and brother-in-law, at a certain point, all the cousins were put together in one room with me, their tita.
So ikaw na lang.
And while I'm quite happy to do it, I can't do it for the entire Philippine population. We will need the public school system to help the parents do this. And
why is it necessary? Apart from, of course, because the questions are already there in the minds of children now.
Young children. Now, in my three sons, I didn't have to refer to anyone else. When they asked, I told them. I told them in a scientific, non-judgmental, and values-full, laden manner, my values, and we may not have time to discuss that. But what I found is that because of that, my children essentially have followed what the studies will say. They are less obsessed about romance. They're less crazy about girls and sex, and sexual debut, the studies are showing, comes far later than if you have adequate sexual information.
Ah, okay.
Okay, so
If they
it's
are
a myth.
informed earlier,
Yes.
they actually more
Are
likely, less likely to
because
experiment.
It's not, it's not mystified. It's not
Okay.
something they have to discover for themselves in crazy ways, and in ways where, as you've said, other forms of media and information makes them more curious and doesn't quite give them the proper values. But let me tell you that I run a daycare center for UP.
Yes.
And we have sex education for 3 and 4-year-olds. And what would that be, right?
Can it be like
Yeah.
a choice of a, for example, if it's a private school and it's not a public school, can they have a choice of including it just the same with or without the RH law?
I would prefer not, because I'll tell you what we teach the 3 and 4-year-olds, and I'm wondering whether there should be an opt-out. We teach the 3 and 4-year-olds non-aggressive ways of resolving conflict. How does that relate to your sexuality? Everything. It will stop you from raping someone later, from bullying the gay person, from hurting someone you love. That's a very important part of our sexuality education. The other part is, what are the parts of your body for 3 and 4-year-olds, and which parts of your body have to be approached and touched by
So you're
only a
saying
few
that there
people
has-
and with respect.
Yeah, so you're saying that there has to be a program
Yes.
that will be followed so that we will all have the same.
Exactly,
You will
because
be on the same
3 and
page.
4-year-olds need to know that certain touches from people are not acceptable, because that is how we prevent from 3 and 4 years old all the way up the abuse that does come to young children, and which we have to face, even if it's an awful reality. It is a reality.
Now, is there a way to compromise those who advocate the RH law and those who are against the RH law? Is there a way to compromise? Is there a middle ground that we can reach?
If I could show you the bill we wanted, those of us who are advocates, and how the final bill turned out, you will see how often, how consistently, even up to the part of the implementing rules and regulations, the RH advocates and our legislative champions accepted every single revision they wanted. Except the revisions that they wanted, which would have made the bill unscientific and inefficient, like take out contraceptives. But so much of the language, the opt-out portion of the education part, the part where you can't give services to adolescents, just information, there were so many things.
So this was already the compromise.
This is the issue, I think, with regards to our fear that the Supreme Court might decide against the law, because all these arguments through the 12 years have already been done, the debates are over, our representatives in the legislature, as well as the Filipino people who are showing consistent support in the surveys for this bill. This is a constitutional bill in this way, because we have done the talk. We have talked about it. All these issues
Have already been,
have
talked
already
about many
been
times.
resolved.
Now, should the Supreme Court deem it unconstitutional, what happens now? Is there any other way we can reach those objectives that we've indicated?
Our lawyers indicate that they have measures still available to them to ask for, I think, a reconsideration from the court. But of course, there are, because of 12 years of advocacy and the very high levels of acceptance, there are some things that can be done by local government units and concerned officials and the public itself to push RH services, because there are a lot of local government units who have their own reproductive health ordinances. So Quezon City has one, Davao has one, and an increasing number. And there have been struggles and victories over local government officials that banned contraceptives. Those have been thrown out as well throughout the country. So there is progress. It's not going to be a total loss. And I really would encourage, and that is the whole point, and I wish we could have this talk like this, maybe in programs that are also reach the CDE, well, the ABCDE, everybody needs it, but more for poor communities, that they should demand these services from their local health units, and the Department of Health should be able to push this despite. But the law is important. in making it a reality sooner and faster, especially for very poor women. I mean, rich women, they can afford it.
Okay. Now, the opponents are going to have their prayer vigils, and I understand that the pro-RH groups will be in Baguio City tomorrow, where the Supreme Court will hold its summer sessions. So
They are already there.
Okay.
My Facebook account is full of beautiful lit pictures from my friends. They turned parts of the road all the way to the where the Supreme Court will be deliberating into purple, which is the color of the pro-RH advocates, with ribbons. I saw some beautiful purple flowers in one of the accounts, and they are already beginning their vigil, their march and their vigil
Okay.
in Baguio. So it would be lovely to be in Baguio if I wasn't here holding the fort.
Okay. Well, thank you so much for choosing to be here in Daybreak
it was
this
a
morning,
pleasure. It's a
Dr.
pleasure.
Claudia.
Thank you.
Okay, Dr. Sylvia Estrada-Claudio, she's the director of the UP Center for Women's Studies. And good morning again,
Good
ma'am.
morning.